So around Q3 of 2020, we noticed an increase in our rate of hypoglycemia for our patients. We had been tracking it, we'd been doing pretty well. This coincided with the start of the pandemic, and also Vizient had placed it on the scorecard. CMS was asking organizations to track this metric, and we identified that we had at least 3 areas or units of opportunity. So we brought a group together. As many do, is very multidisciplinary. For us, that included pharmacy, in this case, dietary, individuals from each of the units, and we really used data and some of the information we had from Vizient to really drive processes and interventions. And one of the things that Vizient shares that was quite interesting is the vulnerability index, which really highlights social determinants of health. And for us, we are in the Southeast, and when you look at the Vizient VBI, that whole area lights up. It's quite red, and we know that there's a lot of social determinants of health in this population. And for us, our patients with diabetes, that was magnified for them if they contracted COVID. And then again, we had some different barriers that we needed to work through.
Yeah, I'd say one of the barriers that we had to work through was transparency of communication on events, when they happened, where they happened, and the circumstances around it happening. And so when we really got the senior leadership buy-in on that, they were very supportive of really setting up new processes for reporting. So that way, throughout the organization, they understood the issue. And they were able to follow up with the physicians, the nurses, dietary, and really get those processes worked out. So we were able to perform at a very high level.
I would say our path to success wasn't without its challenges. We quickly realized that a one-size-fits-all approach wouldn't work in the midst of a global pandemic. Some of our service lines were quick to adopt our protocolized care approach, while others required more encouragement or external accountability to stay on course. The pandemic taught us a few things. It taught us that we must maintain resiliency and adaptability to ever-changing times. And it also taught us that our commitment to patient safety and quality cannot waver. Some key takeaways that we experienced were that patients with high vulnerability have multifaceted care that requires a tailored multidisciplinary care approach. That the integration of clinical decision support into an electronic health record can be lead to substantial results. And then I would say finally, cost neutral strategies are particularly helpful even in today's world where healthcare resources and financial resources are challenging.